Cardiac cycle. The cardiac cycle is actually a series of events that occur from the beginning of one heartbeat to the beginning of the next. So it is stimulated by the spontaneous generation of an action potential in the sinus node. This node is located in the superior lateral wall of the right atrium near the opening of the superior vena cava. And the action potential travels from here rapidly through both atria and through the AV bundle into the ventricles. SA node is also called as the pacemaker. Because of this special arrangement of the conducting system from the atria into the ventricles, there is delay of more than zero point 0.1 seconds during the passage of cardiac impulse from the atria into the ventricles. This delay allows the atria to contract ahead of the ventricular contraction, thereby pumping blood into the ventricles before the strong ventricular contraction begins. The total duration of the cardiac cycle, including the systole and diastole, is the reciprocal of the heart rate. For example, if the heart rate is 72 beats per minute, then the duration of cardiac cycle is 1 by 72 beats per minute, which is reciprocal, about 0.0139 minutes per beat or 0.833 seconds per beat. So, actually, this figure shows different events during the cardiac cycle for the left side of the heart. The top three curves show the pressure changes in the aorta, left ventricle, and left atrium, respectively. The fourth curve depicts the change in the left ventricular volume. The fifth depicts the electrocardiogram, and the sixth curve depicts a phonocardiogram, which is recording of the sounds produced by the heart, mainly by the heart valves. There are four valves of heart. First one is pulmonary, aortic, then comes tricuspid, and then comes mitral. Increasing heart rate decreases duration of cardiac cycle. It is indirectly proportional to the duration of cardiac cycle, right? When heart rate is increased, the duration of cardiac cycle is decreased. When heart rate increases, including the contraction and relaxation phases, the duration of the action potential and systole also decreases, but not by great percentage as diastole. At a normal heart rate of 72 beats per minute, systole comprises about 0.4 of the entire cardiac cycle. At 3 times the normal heart rate, systole is about 0.65. 3 times the normal heart rate. This means that the heart beating very rapidly does not remain relaxed long enough to allow complete filling of the cardiac chambers before the next contraction. Okay, let's learn the relationship between ECG, electrocardiogram, and cardiac cycle. P, then we have Q, then R, and then comes the T wave, right? P, Q, R, this is T. Electrocardiogram or ECG. These are the electrical voltages generated by heart and recorded by the electrocardiogram from the surface of the body in which we use the leads. The P wave is caused by the spread of depolarization through the atria and is followed by the atrial contraction, which causes the slight rise in the atrial pressure curve immediately after the electrocardiographic P wave. About 0.16 seconds after the onset of P wave, the QRS wave appears as a result of electrical depolarization of the ventricles. The QRS. This is actually the depolarization of the ventricles, which initiates contraction of the ventricles and causes the ventricular pressure to begin rising. Therefore, the QRS complex begins slightly before the onset of the ventricle systole. Finally, the ventricular T wave represents the stage of repolarization of the ventricles when the ventricular muscle fibers begins to relax. This is the repolarization phase of ventricles. Therefore, the T wave occurs slightly before the end of the ventricular contraction. So, in a nutshell, atrial depolarization produces P wave, ventricular depolarization produces QRS complex. On the other hand, the ventricular repolarization produces T wave.